Merci à tous d'être là. Je m'appelle Thibaut Gruber, je suis professeur assistant à la faculté de psychologie et d'éducation de l'Université de Genève. Et aujourd'hui, je ne vous parle pas tellement en tant que prof de l'université, mais plutôt en tant que primatologue, puisque c'est mon deuxième job. Donc moi, juste pour la petite histoire, je travaille en Ouganda avec les chimpanzés. Et donc c'est en Ouganda qu'il y a 15 ans, on s'est rencontrés avec Dr Gladys Kalema-Sikusoga, qui donc, est depuis une très très bonne amie à moi. Donc je suis particulièrement heureux d'avoir pu la faire venir en Europe à l'occasion d'une conférence en primatologie qu'on organise à l'Université de Lausanne à partir de mercredi. Donc du coup, on a également pu faire venir Gladys ici. Et donc j'ai quelques petites notes parce qu'il y a quand même énormément de choses à dire sur Gladys. Donc Gladys a eu son bachelor donc, en médecine vétérinaire. Je retrouve ça, au Royal Veterinary College de l'University of London. Elle a ensuite eu un master également en sciences vétérinaires de la North Carolina State University, avant de recevoir en 2023 un doctorat honoraire de nouveau de l'Université de Londres, parce qu'entre-temps, elle a fait énormément de choses, notamment en 1996, elle a créé le premier département de sciences vétérinaires au Uganda Wildlife Authority, qui est donc l'organisme qui traite tous les animaux sauvages en Ouganda. Et elle a également créé, en fait, son master avait vraiment trait, donc ce qu'elle va vous raconter aujourd'hui, sur la santé des gorilles, mais notamment les interactions avec les populations environnantes. Et à partir de là, elle a donc créé une ONG, français, qui s'appelle Conservation for Public Health, donc elle va vous raconter aujourd'hui. Il y a énormément de choses à dire sur Gladys, mais je vais le garder un petit peu court. Elle a eu énormément de prix et de prix internationaux. Alors ça a commencé notamment par le zoo de San Diego, qui a des programmes de conservation particulièrement connus. Elle est également exploratrice pour National Geographic. Elle a également part du Explorer Club Afrique. Récemment, vous avez sûrement entendu parler du fait que Gladys a été nommée championne de la Terre par UNEP, donc les Nations Unies. Et en 2023, la BBC 100 Women a également classé Gladys parmi les 100 femmes les plus inspirantes en termes dans la catégorie du climat. Donc, il y a énormément de choses à dire, comme je vous dis. Gladys a également publié plusieurs livres, notamment celui-là. Donc, elle en a mis plusieurs. Alors, ils sont disponibles à la vente après son exposé. Et donc, je ne vais pas parler plus. Et j'ai l'honneur d'inviter donc Gladys à nous présenter son parcours et à vous raconter sa vie. Voilà. Merci beaucoup pour elle.
Bonsoir. I'm very happy to be here today in Geneva and at the University of Geneva. Thank you so much, Thibaut, for the nice introduction. And it's just great to have various people here, including from conservation community, health. I'm glad to see WHO is here. I'm on the SEGO, Scientific Advisory Committee for Origin of Novel Pathogens. I'm a primatologist, and I'm looking forward to speaking at the conference later this week. I'm also here with my husband, Lawrence. He's standing behind there. He's a founder member of our NGO. I've been working with mountain gorillas for a long time. If I tell you how long, you know how old I am. Almost 30 years, because I started out as a vet student in 1994, and then started working as Uganda's first wildlife vet in 1996. I'm going to talk about my conservation and leadership journey, which has been shaped by One Health. And through talking about working with gorillas, I'll be talking generally about all my journey. I came from a family of 6, where that's me, at the age of 5 months, I think. I was on my mother's shoulder. I was the last born in my family of 6. So by the time my family had me, my parents had me, they let me do whatever I wanted. And my mom was not worried about whether I'm going to earn a living. They just let me follow my passion, because she always said my older siblings would look after me if I'm not able to earn a living. So I was lucky. I could do what I wanted. My dad was a minister in the first government after independence, and the president kept sending him to go to other countries. So once Uganda gained independence in 1962, the president would ask him to lead delegations to other countries. And in this particular one, he was in China. In fact, at the time it was called Peking, the city he was in, and he was leading a delegation to shop for Uganda, including a stadium that eventually was called Mandela International Stadium. And him and my mom were very close. They used to move around together sometimes. So in this particular photo, he was at the Commonwealth Heads of Government meeting, where he was the chairperson for that year. And so these are my siblings. That's me, the baby in the picture, with my older siblings. My older brother really liked animals as well, and he used to always bring stray cats and dogs home. And on the right is my grandmother, my father's mother. That's how most people live in rural areas in Uganda, and she was carrying me. My mom told me that she was a very brave woman. I don't remember her because she died when I was still quite young. She said she was a very brave woman. She used to chase wildlife from the garden, including elephants. So when we moved elephants, when I started working at the Wildlife Authority, my mom thought maybe they're the same elephants, because elephants can live for very many years. And so that's one of the last family photos taken when we were all together. So I'm the baby there with all my older siblings and my mom and dad. And sadly, my dad was killed when I was 2 years old, because when President Idi Amin came into power, he started trying to kill people who he thought were a threat, and my dad was among the first. And so it was very sad. I never actually got to know him. I don't remember him because I was very young. But I wanted to continue his legacy of a prosperous Uganda and to develop the country. So did all my siblings. They've done really amazing things with their lives in their various fields, but mine was my passion for conservation. When I was around 8 years old, I think, we had many cats and dogs at home, but there was a vervet monkey that was owned by the next door neighbor. He was a Cuban ambassador to Uganda. And vervet monkeys are very common in Uganda. They're not endangered like gorillas. But this monkey taught me a lot about primates. He used to like coming home, pulling the cats and dogs' tails. He was a very naughty monkey. And then he would steal food from the kitchen, like mangoes or bananas. And then one time I was practicing the piano, and I felt like I wasn't alone. So any of you who worked with wildlife know that feeling. And I realized he was watching me. So I thought, let me see what he can do. So I came out of the room to see if he would imitate me. And sure enough, he sat on the stool and played one note with one finger. I was like, wow. So not only did his fingers and fingernails look like mine, he can even play the piano. And so I started to really get fascinated by primates. When I was 18, I had the opportunity to set up a wildlife club in my high school, and also got a Six Sciences Award because I was very interested in biology. And we took the students to Queen Elizabeth National Park, which at the time we only had 3 national parks in Uganda at that time. But it was named after the Queen of England. And when we went to the national park, I was sad that there was very little wildlife because a lot of it had been poached during the Idi Amin era. And the elephants had gone to Democratic Republic of Congo. There were no predators, no lions or leopards that people could see, so they allowed us to walk in the park. They told us we should go on a walking safari, which was exciting because but I was worried that, how come there are no predators? And I started to think to myself, well, maybe I can become a vet who also brings back the wildlife. So that was when I started to think about becoming a wildlife vet. But also while I was at the Wildlife Club offices, where I volunteered, before I set up the Wildlife Club, when I was in a long holiday between O-level and A-level, a certain warden came into the offices and said, "We have mountain gorillas in Uganda." And I was like, whoa, what are they? I said, "I'd really like to see them." And the reason why he talked about this is the first population was discovered down here by the late Dr. Diane Fossey was one of the first people to work with the mountain gorillas. But other people had discovered them, but she did the long-term study after George Schaller did a study. And then everyone thought that these were the only mountain gorillas in the world. But in 1987, they were going through the forest, and they found nests, and they found fecal samples. And when they sent them to California, I think it was San Diego Zoo, they found out that they were exactly the same as the ones here. But you can see that at one point, these two forests were connected. But because of human population growth and building up in the area, they had now been separated completely, and they may never be able to get together again because of the high human population density. So the warden told me, they're not habituated, you can't see them. So it was going to take several years before I could see the mountain gorillas. But however, I was able to go to Royal Vet College, University of London, for my university, which was really amazing. They also allowed me to work with animals of my choice. So I came back and I worked with chimpanzees at the Entebbe Zoo, which was very, very exciting. And so over here, I worked with, these chimps were victims of the bushmeat trade. Basically, their mothers would get eaten in DRC, because in DRC they eat primates, great apes. And the babies were too small to sell, so they would bring them into the zoo. They'll try and sell them, and then they would end up in the zoo. But they also taught me a lot about primates, because they were very naughty. They used to, when you're not looking, they would open this fence and escape and run around the zoo. And then you'd carry them back. And that time I was carrying this chimpanzee back. And I noticed that they missed their mothers, because at that age they would still be carried by their mothers. So they like being hugged. But it also made me realize that the devastation and the impact of the bushmeat trade on such animals. And so I learned a lot about conservation being there. But I got a chance to work with chimpanzees in Budongo Forest before I could work with gorillas. I worked under Professor Vernon Reynolds, who had restarted the Budongo Forest Project, which is now called Budongo Conservation Forestation. It was a really amazing experience for me, but I was looking at parasites in the fecal samples of the chimpanzees, intestinal helminth parasites. Then 2 years later, I had an opportunity to work at Bwindi, and actually this photograph was taken not at Budongo, but at Bwindi. And I had a chance finally to study the mountain gorillas with Dr. Liz McPhee. She was heading the International Gorilla Conservation Program and had been a vet in Rwanda with the Mountain Gorilla Vet Project. But this photograph was taken when I went for a walk to the waterfall, because as soon as I got to Bwindi, unfortunately, I got a cold, a nasty cold. And of course, I couldn't go to the gorillas because we can easily make them sick. So Liz McPhee introduced me to everybody, and then she went after 2 days. So the rangers were collecting samples for me from the night nests, and I was trying to examine them in my mud hut, in my microscope in my mud hut that they gave me to stay in for the first time in my life. And then later on, after a week, I got better, finally. And I got to see the mountain gorillas. So I went on the very first trek. The first gorilla that I saw was not in a family, like they normally are. He was on his own. And on that day, they couldn't find the rest of the gorillas in the group. They had moved quite far off. So this was a silverback who was not the main silverback, so he stayed behind. And we got to see him. He was very, very accommodating towards us. He didn't run away. He just stared at us and continued chewing on a piece of bark. But they called him Kachipura because when they habituated them, he had a broken hand. And I felt a very deep connection, and I realized how we could easily make them sick because we got really close to Kachipura. We were at least 5 meters close to him. And I realized that it was very important to protect them. But my main study was collecting samples from their night nests, non-invasive samples. So every day when I finally got better, I collected samples from the 2 gorilla groups, going to their night nests, examining them under the microscope. And I found that the 2 groups visited by tourists had a higher parasite burden than the 1 group visited by researchers. I couldn't tell whether it was only gorilla parasites or human-related, but it showed me what impact we can have on them. But another thing that was interesting is, because I was at Bwindi, in the tourist site, I got to learn so much about conservation because I saw how tourists were already supporting conservation, because already many of the rangers used to be poachers, but now they had a regular job as a ranger, and we used to call them born-again poachers. Also, the tourists would keep inviting me to give them talks about the work I was doing. So I really understood how tourism can have benefits for the communities, but also can have, can be a disadvantage for the community. And it was very important to carry out tourism responsibly. But I also realized how close we could get to the gorillas and how we could easily make them sick. So I wrote to Dr. Edroma, the head of the national parks, and I said to him, I would like to be your first vet. I sent him my report from the study from London. That time there was no email. He got the report and I said, I'd like to be your first vet, and this is what a wildlife vet does. And he said, 2 months later, he sent me a letter saying, your job is waiting for you. Can you imagine? I didn't expect that response, actually. So, and my friends were like, what? And I was like, yeah. So it was a very exciting first job. And as much as they hired me because they were concerned that tourists were going to make gorillas sick with a fatal flu like COVID, actually they got me to do so many other things. So they got me to move elephants. It's not easy to move elephants, as you can imagine. And I had been taught to work with cats, dogs, horses, cows. And he said to me, there are 2 elephants destroying crops. I want you to move them. I'm like, whoa. But he told me, and I told him, but I hear that there's Kenya Wildlife Service are moving elephants. Can I go there for training? He said, yes, you can. So he paid for it, and I went to Kenya Wildlife Service. So the same person who helped them to move elephants, we brought him, Clem Kodsia, and we moved the elephants in Uganda, 2 elephants. They were stuck between a migration route of the 2 national parks, Queen Elizabeth National Park I talked about earlier, and Murchison Falls. So they were in a place called Mubende. So as they used to before could move between these 2 forests, these 2 national parks, they're savanna parks, but because of human habitation, just like the gorilla populations had been cut off, these elephants could not go back. They were in a tiny little forest, and the community had killed almost all of them. So we were able to move them to Queen Elizabeth National Park, which was very exciting. But every time people used to refer to me as the first female wildlife vet, yes, I was, but I happened to also be the first wildlife vet. And during this time, a lot of people were fascinated by the elephants. They were pulling the hair off the tail, when they were down, because it took about 6 hours for the truck to come for the second elephant. So some journalists took a photo of me, and in the local language, this says, how small is the one who brings the elephant down, which is a local proverb in my language. So everybody was fascinated. But when we translocated them, they got there safely, and they never caused a problem again. So it was a good decision to translocate them. A year later, we got to translocate giraffes as well, because there were only 6 remaining in one national park, Kidepo, and only 1 female. So if anything happened to the female, it would be the end of giraffes in Kidepo. And the reason there were so few giraffes is because to go from boyhood to manhood, you had to kill a giraffe. And so the first thing they said to me is, we want you to move giraffes from Lake Nakuru National Park in Kenya, where they had too many, they were eating all the bark, to Uganda. So over here, we're capturing them in Lake Nakuru, and I worked with the Kenya Wildlife Service team, who had a big capture team, and I learned a lot about moving giraffes. And then we took them to Kidepo National Park, and eventually they bred with the 6 that were there, and 15 years later, there were 35 giraffes, which was amazing. And so it also showed the value of translocating animals and how it can really work. Because at that time, no one moved animals, no one treated animals. So everybody thought, okay, so vets are important. They can even move animals. They can help to revive wildlife populations. And so this was successful. But treating mountain gorillas in Uganda had never been done. So everybody used to debate with me. They used to say, you shouldn't treat them, you should only treat them if you really have to. Because if 2 gorillas are fighting and one of them is not able to win the fight and has wounds, if you treat that one, they come back, you're preventing new genes in an already endangered population, because it's normally the lead silverback who mates. And so I learned so much by working with conservationists. But I was excited, I was very grateful when the gorilla organization donated the first set of darting equipment, and it was just in time for the gorillas picking up scabies, because we all agreed that we should only intervene if it's human-related or life-threatening. But it was a bit of a gray area, because sometimes you don't know if it's human-related. But in this case, the gorillas were losing hair and developing white scaly skin, and it seemed to be a very big, we had to do something. So luckily, this vet from Kenya happened to be in Uganda, and I asked him to come and help me. He was evaluating vet needs for the Wildlife Authority, Dr. Richard Koch. And he had seen cheetahs in Masai Mara with scabies, but it was those that were visited by very many vehicles. So he kind of thought it could be scabies. We took ivermectin with us. Works very well with scabies, but not with COVID. And so this gorilla was scratching so much, even under the anesthetic, ketamine anesthetic. He recovered with just one dose of ivermectin, but the baby gorilla, the younger brother of that one, died, and the mother dropped the baby 2 days after this intervention, because we couldn't get to the mother that day. She was very shy. And the baby, even if the baby had died, the mites were still alive when we did a post-mortem, and it showed that it was a very severe infestation, and the baby also had secondary pneumonia. But the rest of the group recovered, and a few years later, another gorilla group got scabies. But then there were other diseases which we weren't sure if it was human-related or not. And in this particular case, this gorilla had a rectal prolapse. The rectum came out of the anus, and we weren't sure whether it was caused by, being in contact with a human parasite. Because when gorillas range on community land, they they can put the fecal sample in their mouth, especially the babies, because they're curious, just like human infants. So I did the surgery anyway because it was life-threatening. And Kahara recovered from the operation. And later on, we set up an NGO to be more proactive about these issues. But we did realize that it was the gorillas that were going into community land that were getting all these funny diseases. And so we felt that we need to do something about preventing disease between people and gorillas. And this is a banana plant destroyed by a gorilla group. Of course, the farmer was not happy. But when I asked him, are gorillas important? When I was checking his crop, he was really upset. He said, yes, my children are employed by the park, and some of the money from tourism goes to support our communities, to build clinics, schools, and roads. But the individual farmer like me, I'm not compensated. So I talked to my bosses, and he became one of the leaders of the human-gorilla conflict team that herds gorillas back when they come out. And because of this, everybody turned to me and said, being the only vet in the organization at the time, they told me that I should set up some health education workshops for local communities. I was the only one who had any training in veterinary public health or epidemiology. And so it was a turning point in my life when I started to realize that you can't keep the gorillas healthy without improving the health of the people. We developed these brochures in English and the local language, and we went to we visited 1,000 people in 8 villages around the park where gorillas are always coming out. And I learned so much from them because I told them what the problem was, how the gorillas got sick. Then I was about to tell them the solution I had for them. But the ranger touched my arm and said, let them come up with the solution. So they did. And their solutions were much better than what I was proposing to them. So I learned that they may be poor and not have much education, but they know what's best for them. And there were really good solutions. Like they wanted health services to be brought closer. They wanted to do more health education so that they don't make the gorillas sick or they don't pick up diseases from wildlife. And they also wanted to strengthen the human-gorilla conflict team that herds gorillas back when they come out. So a lot of this is what we started to do. But I didn't also realize that they were so far away from the nearest health centers. So when somebody gets sick, they put them on a stretcher and carry them up the hill. And by the time they get there, it may be too late. Over here, this is Bwindi, and that's overlooking the Virunga. And so these little boys, I took this photo when they were just outside the park. They were supposed to be in school, but they were herding goats outside the park. So as long as you have people who are poor and unhealthy, you're always the wildlife will never really thrive. And this is something that I felt strongly that maybe we should start an NGO. I was really honored to be featured on BBC, National Geographic, Animal Planet for our work. And a book was written together with another lady, Charlotte. She was featuring women in male-dominated professions. So she wrote a book about me, and then a pilot, an engineer, a social worker, a teacher. but it was trying to get children in Africa to get into the science profession and for girls to do male-dominated jobs. And so my One Health journey began. I went to North Carolina State University and did a zoo medicine residency and a master's in specialized vet medicine. It was exciting to treat gorillas with lots of equipment, not like being out in the bush, you know. We even used to get human doctors to come and help when we had complicated procedures on gorillas. But then I also got to do a study looking at tuberculosis in people, wildlife, and livestock. So I looked at TB in people going close to gorillas, like the park staff or the local communities where gorillas are coming out. And I looked at TB in buffalo, cattle, and people, because some people were getting tuberculosis from drinking unboiled milk from cows, which had grazed with buffalo that have tuberculosis, or by poaching buffaloes directly. And this was another very interesting study because I got to learn how the public health system works in Uganda. Because I went over 2 summers. The first summer, I met people and they'd show me, this is the person who watches me taking my medicine every day for 8 months. And then another person would tell me, we don't have that group yet, like in Bwindi. And this CB Dots was started by a doctor called Dr. Francis Adatu, who found out that the best people to treat people are the people who are within the community, rather than trying to get them to go to the health center, like at Bwindi. And this was later adopted by WHO for all the TB-infected countries in the world, of which Uganda was among the top 20. So I really learned a lot from that. And this also helped me in thinking of what can we do to prevent disease to the gorillas. I also got an opportunity to do a certificate in nonprofit management at Duke University nearby in North Carolina. So when we started the NGO, Lawrence was one of the first donors with $100. He put in $100, I put in $100, we opened a bank account in North Carolina, and we started the NGO. I couldn't really ignore the fact that the reasons the gorillas got sick is because of habitat loss. You know, once it became a forest, a national park, people could no longer cut trees, but gorillas don't know that that they're not allowed to be outside because they used to range in these areas before their habitat was cut. So habitat loss is still a big issue. And poaching. In Uganda, people don't eat gorillas. It's bad luck to look in the eyes of a gorilla. But then when they cross over to DRC, if you eat a gorilla or a chimpanzee, you become as strong as them. That's their belief. And so when they cross over to other countries, they can get poached. But our main concern here was people are still poaching bush pigs, duiker, small antelope, and they set out snares and gorillas get caught in snares. The same thing happens to chimps. And so there were lots of threats to them. This particular gorilla is called Kanyonyi, one of my favorite. I operated in his older sister when he was little, when she had the rectal prolapse, and he eventually became the silverback in the group when his father died of, you'd call it old age because he was over 50 years, which is pretty old anyway for any animal. But Kanyonyi had grown up seeing tourists all his life, so now he didn't fear people. And he used to frighten tourists even when he was a big silverback, and they used to get scared. But at least it was showed how much tourism had moved forward, because unfortunately he died not from a human disease, but when he fell off a tree and he never really recovered in spite of treatment. And then he fought with another silverback and he ended up dying, which is all normal things, natural things. But when I shared a tribute of Kanyonyi on Facebook, we had over 300 shares. But it showed how much people really now care about wildlife. And so this is our office at Bwindi. Very nice view. It's almost like Switzerland, actually. Steep hills with forests and everything. And inside this forest, Bwindi is only 321 square kilometers. It's a very small area. But inside this forest, you don't only have gorillas, but you also have elephants, chimpanzees, you have duiker, bush pig, pangolins. You also have over 300 species of birds and over 200 species of butterfly. And so it's a very important area for conservation, but also it's a very important water catchment area. So the forest is not only important for gorillas, which bring tourists, but also water to support the community. And it's a climate modulator. And so this is what we always tell the communities. And so our 3 integrated programs involve wildlife conservation with a focus on wildlife health, community health with a One Health approach, and alternative livelihoods. We started the alternative livelihoods a few years after starting the NGO, when we realized that many people were unhealthy because they're poor, and the NGOs in the area were not looking at all the livelihood aspects. And so we started to support coffee farmers. And we trained the rangers to monitor the health of gorillas, and because it's more sustainable than just getting NGO people or researchers to do it. And so they monitor the health, they recognize them, they identify them, and every month we collect fecal samples from all the habituated groups. When I started out, there were only 3 gorilla groups habituated, but now, when I was a student, but now there's 27. Can you believe it? So almost 60% of the gorillas in the whole of Bwindi are habituated. And what does that mean? You can get close to them, but it means you also have to follow them every single day for the rest of their lives, whether or not they're tourists, which was a big problem during the pandemic. But we're able to test their samples, and if we find human parasites, then we test them at, that was our first research clinic, then we turned it into a bigger center, Gorilla Health and Community Conservation Center. That was the US ambassador, and then Task Trust helped us to build this. And in this center, we're able to test them for anything that they may have, but also we sometimes test the people, the gorillas, and the livestock for the same things like Giardia, Pitosporidia, even COVID. During the COVID pandemic, we were testing the gorillas using non-invasive fecal samples and working with the health centers to test the people who go close to them. This is a typical scenario that happens at Bwindi. The gorillas leave the park and go into community land, and they still do it. This video was just taken 1.5 years ago. They're still going into community land, and so we still have to find a way to prevent disease transmission when they go into community land. And so we engage the local communities. We get them, the gorilla guardians who had them back, to also collect fecal samples when they're in community land from their night nests. And we also work with women, which is great, because women are normally involved in healthcare and men in conservation. But through our approach, which is a One Health approach, we tend to find that we can engage women more in conservation and men more in healthcare. And so this particular lady, Rehema, was training these 3 ladies. They visit people's homes, they promote good health and hygiene, they get people to adopt hand washing stations, they talk about good nutrition, and they also get them to adopt family planning. They talk about the benefits of the park, the dangers of eating bushmeat, because it can make them sick. They also talk about how they can avoid making the gorillas sick, because many of them are already benefiting from tourism. And they also talk about how they can access tourism revenue. So in 2007, we started off by having 26 people like that. And this was a local health center. We worked with a lady called Lynn Gaffikin. Dr. Lynn Gaffikin got a PhD in public health, and she had worked with other conservation, the big NGOs like WWF and WCS, Wildlife Conservation Society, and World Wildlife Fund in Madagascar. So USAID, when they gave us funding to do this, to start family planning, they gave her to us to help us set up the family planning program. And you can see in the photograph, half of the people are men and half are women. We didn't really intend it that way. We met with the local leaders and said, select someone from your community who can read and write and who can be trusted, because they have to collect a lot of data. And it was great to have an equal representation of gender. They went up to 270, reaching 40,000 people and 7,000 homes. And as I speak now, they're now 429, reaching 50,000 people in 10,000 homes. And because of our approach, women can stand up and give a health talk, which is very good. And so they talk about the benefits of having manageable families, and we developed these flip charts together with our volunteers. We developed a draft, sent it to them, showed it to them. They gave us input, and we continue to develop it. And so, of course, it has the bad family and the good family. In Africa, it's called shaming. It's actually very good at changing behavior. I don't know if it can work in Switzerland, but it definitely works in developing countries, where you have the bad family that has everything wrong, like here. She has already 10 children. She's expecting another one. Half of them are going to school. The other half, they told us, stay behind to chase wildlife from the garden. They're sick. They're really suffering and struggling. When the gorillas come out, they try and herd them back themselves. They get hurt. Disease could spread between people and gorillas. And then there's a good family that has 4 children. They plan for them before they have them. And when they come out, and all the children go to school, when the gorillas come out, they call the gorilla guardians to herd them back. And in the end, in the good family, the boy becomes a ranger, the girl becomes a nurse, and you're like, which family would you rather be? So it's like everyone's like, I want to be like the second family. So it's really helped to change behavior. And we found out when we started the family planning program, the most common contraceptive that people wanted was the injection rather than the pill. So we worked with Family Health International. We became one of their pilot sites to see whether lay community health workers can safely give injections. And we showed that they could, and it became a national policy in Uganda. So we're very excited about that, to see research to policy coming into action. So now it's a national policy. All of them can give injections if they're trained, and they also spread it to Kenya and other places where they're working. And so they started to ask us for livestock because they wanted to sustain their volunteer efforts. We're not paying them a salary. And one of our third founder members, Stephen Rubanga, said, he used to work for Ministry of Agriculture. He's like, why don't we give it as group livestock projects so that it brings them together? And so we did that, and it really worked. So over the past 16 years, we haven't had dropouts, just less than 5%, because they have something that brings them together. And the money from that helps to pay for school fees and other needs. And later on, when CARE came along, they were promoting Village Saving and Loan Association, and we just met them one day, and they put our logo on their passbooks. And so it's been a really great relationship with these volunteers. They're still giving these injections, and we're getting additional support from Population Connection. I now serve on their board. And it's just great that something that started 15 years ago, even without donor funding all the time, has continued. And we also did similar work in DRC. We set up the village health and conservation teams in DRC, where the gorillas are found, in Mount Shabirumo and Mikeno sectors. But in DRC, you can see people are poorer. That's somebody's house. That's their kitchen. And they have actually really embraced family planning, even if they're largely Catholic, because they want to reduce poverty in their home. So we also have 76 village health and conservation teams in DRC, reaching about 5,000 homes. We started to host volunteers, so we host people from other countries. They come and conduct research studies, and some of it led to policy change, and I'll talk about how this happened. But this particular student was from Australia. She was injecting babies as a medical student because the nurses and midwives are overworked, so they were happy to have someone to help out. And then over here, this particular student was from UK, Alison Haynes, from Oxford Brookes University. She was interviewing tourists to see if they're willing to wear masks. This was in 2011, 10 years before the pandemic. We also worked with students from NC State, my alumni. They were looking at disease dynamics between people, gorillas, and livestock at Bwindi. And we're really pleased that the mountain gorilla population is continuing to grow. I participated in the first census in 1997 when we counted 300 gorillas at Bwindi to add to the 350 in Virunga to make 650. Of course, you may wonder how they jumped from 254 to 650. It was because in 1981, everyone thought that the only mountain gorilla population was the Virunga population. And so the last census, we counted 459 gorillas in Bwindi to add this to the 604 in Virunga to make 1,063. There hasn't been another census since then because of the pandemic, but we're hoping to have one this year in Bwindi, and they're showing a positive growth trend. There are only just 1,000 left in the whole world, but because their numbers are going up steadily, IUCN removed them from critically endangered to endangered. The rest of the gorilla subspecies are critically endangered because their numbers are going down. The Western lowland gorillas are like 100,000 estimated, but their numbers have really gone down. Over 5,000 the numbers have gone down because of the bushmeat trade and Ebola. In Congo, Brazzaville, and Central African Republic, gorillas died of Ebola, and people died of Ebola who ate those gorillas. And so there's still a problem with the Western lowland, the Cross River, and the Eastern lowland. And I think also because there's no tourism or anything else, no benefits to the community. So last part of my book is talking about sustaining conservation. And we started a gorilla conservation coffee because we were concerned that some of the people around the park were not benefiting from tourism, and they were still going into the forest to poach and collect firewood. And so sometimes when people go to visit the gorillas, they told them this is a coffee tree. Of course, everybody's excited because The only time they've seen a coffee is in a cafe or a supermarket. So they're like, okay, this is how a coffee tree looks. But my husband Lawrence thought, why don't we create a global coffee brand to save gorillas through coffee? So when they come, when you're trekking, you can support the farmers by buying their coffee, and a donation from it goes to support our work to improve the health of the communities, the health of the gorillas, and the livelihoods and of the local communities. So the first brand was named after my favorite gorilla, Kanyonyi. It's 100% Arabica. It's very good coffee. It fetched 92 points on Coffee Review, and which was nice because it was among the top 30 they reviewed in California that year. So now we're getting all the farmers to produce the same kind of coffee because it's another way to sustain conservation efforts beyond tourism. And actually, during the pandemic, there was no tourism at all, like anywhere else in the world, in the first 6 months of the pandemic. And this particular place, this is the airport in Uganda, they used to order every week. When the pandemic started, they didn't order for 6 months. And so we were able to get Vicky working with Maniro Beans, she founded Maniro Beans, to buy coffee from UK. It would go on the cargo planes. And this helped to keep farmers out of the forest. Because the money should pay, would then buy the coffee from the farmers, and then they don't have to enter the forest to poach. But later on now, we started to expand our market to US, New Zealand, and other countries, which is great. Even in Switzerland, at one point, someone sold the coffee here for a few weeks. I'm going to end by talking about gorilla tourism. How many of you have seen gorillas here? Great. As tourists or researchers? Researcher. Tourist. And so when you visit the gorillas, this is what you're told. This is how it used to be. You have to be 7 meters away, and these tourists were actually viewing them 7 meters away, which was good. But we conducted a study with 2 students. One student was looking at how close people get to gorillas, first from Ohio University in America, and she found out that 98% of the time, they were getting too close to the gorillas, in spite of the rangers telling them that they shouldn't get too close to the gorillas. 60% of the time, it was the tourists who broke the rules. 40% of the time, it was the gorillas that broke the rules. They got close to the people. They were curious. And so this was a big issue. But when the pandemic came, we realized it's going to be a bigger issue. Because if you remember, if you get too close, you're going to make each other sick, including our other cousins, the gorillas, who are also great apes like us. So we advocated to upgrade the regulations where everyone who visits has to wear a mask. We advocated to the government and they accepted it. And this also actually fitted in with the IUCN guidelines and the Gorilla Pathology Specialist Group. So now everybody, they take your temperature before you go in, just to make sure you don't have subclinical infection, and you have to do more hand washing and disinfection. We also worked with the local hospital, the Bwindi Community Hospital. And so we prevented COVID spreading between people and gorillas through education and testing. We also tested, as much as we're testing the gorillas, we made sure that also the people were being tested. And we joined the Ministry of Health COVID-19 task force because we had joined the one for Ebola, Marburg, anthrax. We also joined COVID. And we were able to work all through the pandemic. We're actually considered essential workers because they felt it was very important that we're preventing COVID among people and between people and gorillas. So we were able to train the village health and conservation teams and gorilla guardians. When you're herding back gorillas, you put on a mask. They got people to adopt hand washing stations. They did a lot of contact tracing and referring people to health centers who they thought had COVID. And they really helped to prevent the Delta variant, getting worse when we had run out of oxygen. But we had a tragedy during the pandemic. This particular gorilla was killed by a hungry bushmeat poacher. He wasn't poaching the gorilla to eat it, but he was hungry and the local economy had gone down. So he went into the park, poached duiker and bush pig, as you can see. And when the gorilla charged, when he speared the bush pig and it screamed, he speared the gorilla out of self-defense. So he was put in jail for 11 years, which is the longest anyone has been put in jail for killing gorillas. But then we decided that this was also an essential activity, meeting with reform poachers. And that's when the women told us that they urged their husbands to enter the forest to get meat to put food on the table. So they urged them to poach. And so that's another reason why it was important to work with the women as well. And when we checked on Rafiki's group, they were very wary, and we were very concerned. But this particular porter had a mask saying, "In memory of Rafiki," because everybody was very concerned that he had killed this gorilla. The community was upset with him because he was the first gorilla to be habituated in the southern sector and had helped to start lifting some of them out of poverty. But we thought that, you know, as long as you have many hungry bushmeat poachers, people are going to keep poaching. So we started a program called Ready to Grow, where we give fast-growing seedlings to vulnerable people, and the poacher's wife was a beneficiary. We give them fast-growing seedlings that can grow within 1 to 4 months, so they don't have to enter the forest to poach. And we gave them 10 different vegetables. And when we distributed the first 1,000, we did a questionnaire. A majority of people said people are poaching because they're hungry. So this became part of our One Health approach. And in 2022, we distributed to 1,500 households in total. And recently, most recently, last month, we distributed to another 1,500. And this has really helped. So it's another thing we've carried beyond the pandemic. So responsible tourism is now the new norm. Everyone has to wear a mask. But we also encourage tourists. It's not enough to just visit the gorillas. You should also visit the local community. Because when a community member meets a tourist, they're much less likely to poach. Like, for example, he was visiting this. Actually, this was German TV. He came from DW, and he wanted to film the various aspects of COVID, like how we're preventing COVID between people and gorillas, but also how people are eating bats in Mount Elgon, believe it or not, during the pandemic. So he filmed them eating bats and then us how we're preventing COVID and trying to see all the different ways that COVID can be prevented or how people are putting themselves at risk from picking up diseases from wildlife. And I convinced him to buy a craft from this community member. And then later on, we developed a policy brief on responsible tourism to great apes. There are actually 13 countries in Africa that have great ape tourism out of the 21. And this is for gorillas and chimpanzees. And they're either in Francophone or Anglophone countries. And we developed the policy brief in French and English, together with International Gorilla Conservation Program. And when we did it at the first Africa Protected Area Congress in Rwanda, we had two operators there, Praveen from Volcano Safaris, Manzi from Wilderness Travels, and then we also had the Deputy Director of Rwanda Development Board, the Chief Warden, and Dr. Emmanuel Nomad in Ivory Coast, who's promoting responsible chimpanzee tourism. We also developed this website, Protect Great Apes from Disease, where it looks at all the different ways. It's geared towards travelers. And we work together with the University of Exeter and the Robert Koch Institute to do that. Women in conservation is another part that I write about. I have a chapter on women in conservation in the book. And when I started out, there were no female rangers. Now 20% of the rangers at Bwindi are female, which is great. The more women they see out there in the bush, the more likely they'll get women to start doing these jobs. She's one of our top rangers. She's a woman. This was the first day that everyone had to wear masks when they visit gorillas. And it's good that we're able to get women to get engaged in conservation. And I'm on the Women for Environment Leadership Council. We developed We Africa because we saw that a lot of women were not leading conservation efforts because they're always undermined. So we try and mentor them to have more self-esteem and to be able to lead the efforts and realize their dreams. So the first cohort those were the first cohort in Africa. We're also strengthening African leadership in primate research and conservation. At many conferences, you hardly have any people from Africa, even if they're talking about primates in Africa. So we decided that it was very important to also start engaging them. And so Dr. Inza Kone, who was actually here a few days ago at the University of Geneva, he sent me the poster. He sadly is not able to be here today, but he is the president of the African Primate Society, and I'm the vice president. So the first conference was held in Ivory Coast. Inza hosted us, and the second one was held in Uganda. At both conferences, over 80% of people were from native African countries. They presented abstracts and presentations, oral presentations, and they became confident. Because if you don't have people who are confident, they're most likely not to stay in conservation, and they'll still become members of parliament. In Uganda, we're having a current debate about whether people should cut down trees to plant sugarcane. In Bugama Forest Reserve, where Dr. Thibault is working. It's a very big problem. And if you have more parliamentarians who care about conservation, then you won't have to have such debates. So the conference was held. We had the ambassadors there from Japan, and we also had the minister there, and it was really good. We took the US ambassador to the gorillas. She was so excited to see them, and then she became a big advocate of mask wearing. This is one of the hand washing stations that's there. Once you get to the park, everyone has to wash their hands before they go to the gorillas. So actually the pandemic has really helped gorilla tourism, because people are used to hearing messages like, put on a mask, social distance, wash your hands. So that really helped. I took my mother to visit the gorillas many years ago. That's me and my mom. When she was 70, about 20 years ago, 25 years ago. And she became a gorilla conservationist because of that. Before that, she was very scared of me visiting the gorilla. She thought they would maul me and kill me. So she almost stopped me studying them. But after she saw them, she goes, oh, they're just gentle vegetarian giants living in a big salad bowl, because they are very gentle. So she wrote a book about her she's one of the first female politicians in the country, and she wrote her autobiography. She's now 95. And we're really proud of her that she wrote this autobiography. Our two sons, Indigo and Tendo, have been going to the gorillas since they were babies. We decided to space them like the gorillas, 4.5 years apart. And they're doing really well. I mean, the reasons why gorillas do it, they're more logical than us, actually, gorillas and chimps, because they don't have the second baby until the first one is independent, can build his own nest, and can help to babysit the younger one, and they're emotionally independent. So we did that, and it's worked really well with our boys. And actually, whenever we go to human health conferences and say, gorillas are better than us at family planning, the medical doctors don't want to believe it. They're better than, but they are. And this lady from CNN, Jane Vergy, interviewed me, and she told me you should write a book, so I'm glad that I've finally written it. And our older son, Indigo, wrote this book when he worked at the zoo when he was 13. He eventually wrote it when he was 16, and it won a Children's Book Award. And then his younger brother, Tendo, wrote a book about COVID. I mean, he wrote an article in the local newspaper about COVID and gorillas. So they really, because he followed me on so many trainings, so he could get out of the house during the pandemic. We're also working with kids to help to pick up plastic with support from National Geographic and Global Gain STEM. And a lot of them tell you people poach because they don't have an alternative livelihood source. So we're helping them with raising livestock. I was very excited to become a UNEP champion of the earth for our One Health approach to conservation, and to be among the BBC 100 women for preventing. They saw us as climate pioneers because the One Health approach is helping to address the climate crisis. I'm really honored to receive all these awards and recognition, and very excited to have people from WHO here. Alice and Jeff are here. It's really exciting to have you here. And I was so happy to get an honorary doctorate from my old vet school, put on a gown again after all those years, for our One Health approach to conservation. And what you can do, you can follow us on social media, sign up for our monthly newsletter. This is actually a student from India who came and did some work with us. Make a donation, visit us, partner with CTPH, stay at our camp, do research and field training of student groups, buy the coffee, and buy Walking with Gorillas. Stay at our camp. This is the first conservation cafe. Drink some of the coffee. These are students from Mississippi State University who came. And over here, come and basically, come and see what we're doing. I was so excited to be on TV Monde on Thursday last week. They interviewed us about the book and about our work and how we minimized the impact of the pandemic. So it was very exciting to be on there. And these are the various places where we've promoted the book in US, UK, South Africa, and other countries. And please visit us in Uganda and learn about our work. We're very excited to celebrate 20 years of conservation through public health last year, and we hope we'll continue to grow our impact. One of the biggest issues is expanding the park, but also going to other countries with our One Health approach. Thank you very much.
beaucoup, Gladys. Pardon, en français. On a le temps pour des questions. Vous pouvez poser vos questions en anglais ou en français. En français, je les traduirai à Gladys en anglais et je vous ferai la traduction également. Mais vous pouvez poser. Alors, je viens juste d'apprendre qu'il n'y a pas de micro. Donc, on va faire ça un petit peu. Voilà. Donc, yes. Question tout en haut. Ouais.
I'm not sure if I listened. Did they ever get COVID? Gorillas? Was it transmittable at the end?
Thankfully not. As far as we know, they didn't pick up COVID. We kept collecting samples from them regularly, all through the pandemic. And together with Uganda Virus Research Institute, which is a human lab, they were checking them. And we didn't find gorillas with COVID. And we hope we didn't miss it, but we also didn't see clinical signs. So we assume that they didn't pick up COVID. But because early on, we make sure that people wear masks who visit them. And even if they come into your garden, they're supposed to wear a mask and call the gorilla guardians to herd them back. So yes, thankfully, they didn't pick up COVID. But going forward, we don't want them to pick up anything else, COVID or anything else. So everyone has to wear masks, even now.
D'accord, donc en fait, j'écoutais pas complètement, mais donc monsieur demandait s'il y avait des transmissions, si les gorilles avaient pu être contaminés par le Covid, et du coup Gladys a répondu que c'était pas le cas, que les gens avaient utilisé beaucoup les moyens de prévention comme les masques, pour justement que si les gorilles venaient dans leur jardin ou des choses comme ça, pour ne pas les contaminer.
Thank you.
You mentioned you didn't really mention the impact of climate change in this area. Can you say a few words about that?
Yes, thank you for mentioning that, asking that question. We've not really studied the impact of climate change on the gorillas, but we're seeing certain things that concern us because, for example, we're concerned about the infectious diseases going up. In the area where we're working, people never used to get malaria. When I used to go there, you never even used to use a mosquito net. But now that it's warmed up and there's a lot of malaria in the area, and many people are vulnerable because they've never been exposed. And we're worried that other infectious diseases will go up and spill over in between the people and the wildlife. So we're studying that. And also at the same time, we don't know if gorillas are going out often because almost all the habituated gorilla groups are leaving the park. We don't know whether it's because their habitat is not big enough and the numbers are going up and the groups are splitting, or they're looking for food, or some of their food that they eat in the forest is not so available, so they're going out more. And so this could also be an impact of climate change. But definitely in our area, it's hot when it's supposed to be cold, it's raining when it's supposed to be dry, and when there's a lot of floods, people's crops get wiped away, and then they go into the forest and poach. That we've seen, which is really sad. Even some of the people we provided with ready to grow, they lost their cabbages and different kinds of crops. And so, yes, it's affecting the community, and I think it's eventually going to affect the wildlife and the gorillas, but it's something we're studying. And currently, right now, we have a weather station, and we hope that as we collect climate data, we're also collecting all this other information. And we'll have more conclusive information. But yeah, it is a problem. But although the forest is a climate modulator because there's trees, so it's helpful that there's at least that forest is there compared to other parts of Uganda where it's quite bad.
C'est des réponses assez longues, donc je vais essayer de le faire un peu court. La question portait sur s'il y avait déjà des effets visibles des changements climatiques. Et donc Gladys disait qu'il y avait plusieurs choses qu'on pourrait regarder, notamment donc, qu'il n'y avait pas vraiment d'études qui étaient faites, mais qu'il y avait quelques indices qui montraient qu'il pouvait y avoir des choses qui devaient être regardées. En particulier le fait que, par exemple, là où elle travaille, il n'y a jamais eu de malaria depuis plein d'années parce que c'est trop haut par rapport, enfin, en termes d'altitude, et pourtant depuis maintenant quelques années, ça commence à se développer, c'est-à-dire qu'il fait trop chaud, il y a les moustiques qui sont arrivés, les gens sont contaminés par la malaria, donc il y a des changements qui se voient à ce niveau-là, donc elle est assez inquiète du fait que ça pourrait aussi être d'autres maladies plus infectieuses par exemple ou d'autres parasites. Il y a également le fait que les gorilles ont tendance à vraiment sortir du parc en ce moment, on ne sait pas où ils vont. Et ça, c'est peut-être parce que la nourriture se raréfie, qu'il y a trop de gorilles, enfin, il y a plus de gorilles puisque les populations grandissent. Et tout ça, c'est peut-être aussi le fait que la nourriture vient à manquer dans la forêt, ce qui peut être aussi lié au changement climatique. Donc toutes ces parties-là doivent être regardées. D'autres questions ? Oui.
You mentioned at the beginning of the conference the transportation of elephants and giraffes. The question is if you have more gorillas in this region, and too many perhaps at a certain point, would it be possible to transport them to another place in Africa?
Yeah, well, that's an interesting question. Yes, translocation is an important conservation tool, and it really worked with the giraffes. The population was revived, and the elephants, they moved away and they stopped causing a problem. The problem with translocating gorillas is that they're in a family, and they move in a family ranging from about 6 to 25 or 30 gorillas. So if you can't really just remove one, you have to remove them as a family. So it's really difficult to translocate them. And also their habitat is very specialized. That's why you hardly have any mountain gorillas in captivity. If they're only in their range countries, but there are no mountain gorillas in captivity in Europe, America, or anywhere else. It's just the western lowland. So translocation is not really an easy option or a good option for the gorillas. And it's better to, actually what we're trying to do instead is to expand their habitat. We're trying to convince the local community members to sell their land so that we can expand the protected habitat, especially the neck of the park where almost the north and the south are being cut. And some of them are very willing to because they can't use that land. Wildlife is always going on it, not just gorillas, but baboons, monkeys, other wildlife, bush pigs, and they can't even cultivate. So the land is not useful for them. And so we're trying to raise money for that. And also, if we don't buy the land, the tourist lodges are going to buy it, and which isn't good in a way because they'll tell people, come and stay at my lodge and a gorilla will visit you. And of course, it's not good because it exposes them to disease, but it also cuts off their habitat. So we're trying to, it's the next fundraising campaign we're trying to do.
Donc là, la question, c'était plus par rapport au fait si c'était possible de transporter des gorilles dans d'autres endroits, notamment en Ouganda ou en Afrique. La réponse de Gladys étant que ce n'est pas une bonne solution parce qu'on ne peut pas transporter juste un gorille, il faut transporter toute la famille. Et qu'en fait, finalement, il n'y a pas beaucoup d'endroits où les transporter parce qu'ils ont vraiment des conditions spécifiques pour vivre. On ne les appelle pas gorilles de montagne pour rien. Et donc, en fait, elle, ce qu'elle dit, c'est que finalement, ce qu'il faut faire, c'est plutôt étendre ces aires où ils habitent déjà. Notamment, par exemple, à Bundi, il y a un goulot d'étranglement, en fait, qu'ils essayent à l'heure actuelle d'étendre, qui permettrait justement, donc, si on augmente la forêt ici, ce sera pas, les gens ne peuvent pas cultiver parce que c'est beaucoup trop abrupt. Mais par contre, on peut très bien faire un lodge où les gens vont dire, bah, venez, il y a les gorilles qui viennent ici. Donc, c'est justement pour ça qu'elle essaie de lever des fonds pour garder ces endroits vraiment sans habitation ni rien pour que ce soit rendu à la forêt.
I'm just curious on whether there is like a regional approach on your efforts together with Rwanda. You mentioned DRC at some point, but I was wondering about Rwanda as well.
Yes, there is a regional approach as well. I would say that the One Health approach is picking up in other countries. We're doing some work in DRC, but also the Rwandese counterparts are trying to implement it. They actually want us to also set up a program there. And then there's also the International Gorilla Conservation Program that has tried to set up the same tourism in the 3 countries, started many years ago. And then there's also the Greater Virunga Transboundary Collaboration, which is trying to get the 3 governments to work closely together to do joint patrols, let's say if gorillas cross to Rwanda or DRC, and also just joint activities so that we have the uniform activities. So we all got together during the pandemic to see how can we prevent the gorillas picking up COVID. And so we all decided at once, the countries decided everyone should wear masks so that tourists don't think, if I go to Rwanda, I don't have to wear a mask, or if I go to Uganda, I don't have to wear a mask. It had to be uniform that everyone puts on a mask. The governments, maintain the 10-meter distance. So all of that is helping to harmonize and promote good practices for conservation and public health.
Donc là, la question, c'était plus de savoir s'il y avait des initiatives qui étaient plutôt régionales, plutôt qu'uniquement liées à l'Ouganda. Et la réponse de Gladys était qu'effectivement, ils se parlent entre les pays, notamment le Rwanda a aussi demandé à ce qu'ils développent leurs activités. Et en général, il y a plusieurs organisations comme ça qui essayent de garder les mêmes règles, notamment pour le tourisme, etc., pour tous les gorilles, en fait. Il y avait une question juste derrière, je crois.
Just wanted to ask, it's a bit related to what the lady asked here. Are there conservation efforts to educate people? You mentioned about poaching in DRC or meat, poaching to, so I just wanted to understand if the neighboring countries have the same interest in protecting, if they wander to the habitat there.
Yes, that's a great question. Some parts of DRC, they really have conservation efforts. Like the southern part of Bwindi, the southern part of in the Virunga area, it's a national park. And when it's safe, tourists can come. So they care more. The problem is it's quite dangerous to get to the communities because of the rebel activity. But we actually have village health and conservation teams who also go out and talk about these issues. Unfortunately, they're cutting a lot of trees to create charcoal because they don't have other alternatives. So there's a lot of pressures on the Virunga National Park, both the southern area and the North Virunga National Park. But there is a will to improve the situation in DRC, but it's just quite dangerous to work there, so there's not as many conservation efforts. Yeah, but there's definitely people realize we need to not poach, there's a greater awareness that eating bushmeat can make you sick, but there's still a long way to go because it's a very cultural activity.
Donc là, la question, c'était de savoir s'il y avait, par exemple, notamment en République démocratique du Congo, s'il y a aussi cette volonté des gens de protéger leur vie sauvage, etc. Et Gladys répondait qu'effectivement, même s'il y a la volonté, il y a beaucoup d'obstacles, parce que c'est quand même des endroits beaucoup plus compliqués d'accès, ne serait-ce que pour la conservation, c'est pas du tout, c'est dangereux pour le tourisme, parce qu'on sait qu'il y a toutes les activités rebelles, etc. Donc les gens sont obligés aussi de survivre, donc ils vont dans la forêt, ils vont couper la forêt pour faire du charbon, des choses comme ça. Donc même s'il y a une volonté, c'est comme dit Gladys en anglais, c'est a long way to go, donc il y a quand même beaucoup de chemin à faire avant qu'on se retrouve dans la situation du Rwanda ou de l'Ouganda. Est-ce qu'il y a d'autres questions?
Problem of the gorillas leaving the park?
Non, la consanguinité.
Do they fight?
No, if you marry with, if you're marrying your own family, in your own family.
Okay, inbreeding.
Inbreeding and so
on. Okay, yes. Mm-hmm. There's partial inbreeding, like syndactyly. Like in humans, it's called syndactyly, where the digits fuse. That's considered to be inbreeding. We've seen it in a few gorillas. Like the one I did the operation on had partial indactyly, the one that had rectal prolapse operation. And that's a big concern, actually. But they help themselves a little bit because when the girls, the female gorillas become teenagers, like 10 years old, and they can start mating, they leave the group because they don't mate with their dads. So that helps. And then they get to other groups. They try and prevent it amongst themselves, but it can't be totally prevented, I think, because they tend to range and you see a gorilla in a certain group, a few years later, that same gorilla is now in another group ranging nearby, and is having babies in that group and that group. So there's a bit of an issue over there. But yeah, inbreeding is a little bit of a problem, but they help themselves by, they're intelligent enough that the dads don't mate with the daughters and things like that.
Donc là, la question, c'était sur la consanguinité, parce qu'effectivement, les populations sont quand même très, très faibles. Et Gladys disait que, bon, déjà, il y a les gorilles, comme d'autres grands singes, ont quand les femelles arrivent à l'adolescence, en fait, elles partent pour rejoindre d'autres groupes. Donc ça aide à éviter ces problèmes de consanguinité, mais qu'elle a vu notamment, donc une des photos qu'elle vous avait montrées d'une des gorilles, elle avait donc un syndactylie, je crois que en français ça doit être ça, où donc les doigts sont joints, donc ce sont des signes potentiels de consanguinité. Donc il y a on va dire des barrières naturelles avec leur système social, mais il y a quand même des indices qui font que la population n'est pas suffisamment grande. I think we're going to final question, and after we'll stay here because I think you want to write your book. So we.
I just would like to have some information about tourism because I understand it can be positive for the country, but also it could be negative because if too many people come. So how is it regulated? And is it regulated in each country, or is there a policy amongst all the countries to limit the numbers or to monitor the numbers?
Yeah, that's a great question. Tourism is very important, but it has to be done responsibly. So to visit the gorillas, it has to be a maximum of 8 tourists per gorilla group per day. And it's uniform all over, in Uganda, Rwanda, and DRC. They have to be healthy. Now they have to wear masks. So that really helps to minimize behavior disturbance and too much disease and, too much overcrowding. Because even for the tourists, they don't enjoy it when and it's harder for the rangers to manage the tourists because they're wild animals and they're habituated, but they can turn on you. So you have to make sure that, they manage it properly. And we're trying, this policy brief is now for all the countries in Africa that have great ape tourism. So everybody, and also with chimps, it's a bit of an issue, but we're trying to minimize also in other places so that not too many people are visiting the same group of chimps. But yeah, it's very important to do that. That's what you have to do for great ape tourism. For savannah, it doesn't really, can sit in a car and however many of you, as much as it's not good to have too many vehicles. But for great apes especially, you really have to limit the numbers. Otherwise, it's not good for the great apes. Both the animal great apes and the human great apes. It's not good.
Donc là, la question, c'était par rapport aux limites pour le tourisme. Donc comment faire du tourisme, de l'écotourisme responsable. Et donc il y a des règles qui sont suivies par les 3 pays de manière uniforme. Donc c'est 8 touristes par groupe de gorilles par jour maximum, parce que c'est important, parce que sinon les gorilles se stressent, ils peuvent être un peu s'énerver. Alors c'est à la fois vers les touristes et aussi vers les rangers qui les suivent tous les jours. Donc c'est de manière importante qu'on régule ces choses-là pour que ce soit fait de manière uniforme. Et Gladys disait que c'est pas forcément que pour les gorilles, c'est aussi le cas pour les chimpanzés et les autres grands singes, par rapport peut-être à quand vous faites du tourisme ou un safari. Voilà. Donc je vous propose de remercier une dernière fois Gladys.
Thank you.